Bismillahirrahmanirrahim. So today we are going to discuss about the Mucoepidermoid Carcinoma. We have already discussed the salivary gland tumors are classified into two types, the benign and the malignant. The benign tumor we have already discussed the pleomorphic adenoma and the Warthin tumor. And the malignant tumor, the most important one is the most common one is the Mucoepidermoid Carcinoma. In this name you can see Mucoepidermoid Carcinoma. It means that it consists of two components, the mucous component and the epidermoid or the epidermis-like components. So mucoepidermoid carcinoma is the most common malignant tumors of the salivary gland. It comprised about 15% of all the salivary gland tumors. It is rare, and this tumor most commonly occurs in the parotid glands. It most commonly occurs in the parotid glands, but they may also arise in the minor salivary glands. And the formula or the rule regarding the malignancy of the salivary gland tumor is that the smaller the gland having a neoplasm, so the greater the chances that this neoplasm is not benign, it is malignant. So the small salivary glands often involves the malignant tumor. And this mucoepidermoid carcinoma may range from the low to intermediate or high grade depending upon the differentiation, and it commonly involves the most important complication that it commonly involves the facial nerve, so producing facial paralysis. Now let's talk about the morphology of the pleomorphic adenoma. So mucoepidermoid tumor, it is going to be grossly seen as apparently circumscribed, lacking well-defined capsule, and due to this lacking, it can infiltrate into surrounding tissues. And on the cut surface, we can see pale to white masses having mucinous cysts. Histologically, we can see cords or sheets or a cyst of the squamous, mucous, or intermediate cells. As I have already discussed, that consists of both squamous and the mucous components. Mucous in the sense that these mucous cells consist of vacuoles having mucin, and the intermediate cells, which are the hybrid cells, consist of both the features of the squamous cells and the mucous cells. This mucoepidermoid carcinoma may range from low grade to high grade, and in between there is also intermediate grade. This grading is based on the differentiation of the cells. The low grade tumor have well differentiated cells, and the high grade tumor have highly anaplastic or low differentiated cells. It also depends upon the metastasis. For example, these low grade tumor have high chances that they don't metastasize to the other organs, and the high grade tumor, they have high chances that they will metastasize to the other organs. This other important point regarding the low grade tumor, that it has a 90% 5-year survival rate, and the high grade tumor has a 50-year survival 5-year survival rate. And the low grade tumor occurs in about 15% of the cases, while this high grade mucoepidermoid carcinoma recurs in about 25 to 30% of the cases. So here you can see the histological picture of the mucoepidermoid carcinoma. Here you can see these are the intermediate cells. Here these are the squamous cells, and these are the squamous cells, and here you can see the mucous cells. So it is the histological picture of the mucoepidermoid carcinoma having intermediate cells, squamous cells, and the mucous cells. So that's all for today. Thank you.